So good evening, everyone. First of all, I really wanted to thank the organizers, not only for giving me this opportunity to speak, but inviting me to this conversation. It has been a fascinating conversation till now. And all the slides that I had prepared have been presented. So therefore, I'll be very brief and I'll skip most of the slides. I work in the Public Health Foundation of India, and we have a center called the Center for Environmental Health, which supports various healthcare facilities across India in terms of becoming sustainable. So therefore, the conversation that I want to have with you today is primarily around some of the actions that we do in order to make the hospitals sustainable. But before that, we believe that there is an action happening in the climate, which is climate change. And therefore, our strategy to that is what we call a react strategy. There is an action happening and we react. The REACT is an acronym. It stands for research, evidence, advocacy, capacity building of the community, and technical assistance. So my conversation will be around this aspect. But first of all, we need to understand that the community that we would like to serve through the health facilities, what are some of the outcomes of climate change in those communities? We say that there are 4D outcomes, primarily broadly. The 4D outcomes are the disasters that happen, the floods, the earthquakes, the various kinds of disasters because of climate change. The second is the diseases that happen, the acute diseases, the chronic diseases, diseases in the children, diseases in the adults. The third is the displacement of the population that happens because of the climate change. All of us know about what has happened in one of the famous towns of Uttarakhand, that the town is almost becoming uninhabited now. And finally, the D is about the disruption that happens in their lifestyles, the disruption that happens in their livelihoods. So therefore, when we talk about healthcare, we need to understand that we are not only addressing the disease, but we are addressing the various kinds of disaster-related issues, the displacement that has happened in the population to a completely new setting, and the disruptions in their livelihoods that needs to be addressed. But then there is one D, which actually envelops all of this. And that D is a very important D for us to remember, that the impact of climate change disproportionately affects populations. And therefore, we really need to understand that different segments of the population, the ones we define as vulnerable population, need to be addressed more deeply. And therefore, it was a real pleasure for me to hear my previous speaker of the hospital that he runs and the population that he caters to. We need to remember that there are these various kinds of segments of population that really require healthcare. Now, coming to this, we talk to various segments of the population, various senior hospital managers, various philanthropic organizations who run hospitals. We talk to healthcare workers across public, private sector, and we talk to the community. And we try to understand from them that if we are talking about sustainability, what does sustainability mean for them? Because as one of my previous speakers said, that sustainability is a concept. The brilliant definition that Glo Harlem Brundtland has given to all of us about preserving the current climate and ensuring that our future generation, our children, our grandchildren, they do not suffer because of our actions today. All of us, this is good in theory. But what does it mean really to these people, those who run the hospitals, the community, the healthcare worker who provides the service? And they came up with 4 E's. The first thing that they said that if sustainability does not lead to an increase in efficiency, then sustainability does not have any meaning for them. Or in other words, many said that if in the process of becoming sustainable, I have to compromise with my efficiency, I will not go for that because efficiency is very important for me. The second thing that they said is that the economics part is very important for us. We need to clearly understand that if we are investing today to make ourselves what we call as green hospitals, then what is the return in the midterm, in the long term that I get out of this? I can invest some amount today to become energy friendly. I can procure some costly instruments, but what will it lead to in 5 years, 10 years? And I think we heard from the speaker from Denmark about how Denmark is really doing some fantastic, Netherlands, how Netherlands is really doing some remarkable work in terms of understanding the economics part of it. It's very important for us to place that as an evidence. The third thing that they talked about is what my previous speaker spoke about, that we are thinking about equity. If by becoming sustainable, I lose the population that I would like to cater to, the vulnerable population, then sustainability has no meaning for it. And obviously, all of them understood that with sustainability, there is an issue of environment friendliness. Everybody wants to be environment friendly. In today's world, becoming environment friendly is something which everybody embraces. So therefore, when we talk about becoming sustainable, we will have to understand that it is about efficiency, it is about the economics, it is about equity, and it is about becoming environmentally smart. Now, there is a practical question that comes up to us, that what do you really mean by us becoming sustainability? What is the formula? What do we need to do? We spoke to various kinds of hospitals and various health workers about what does the sustainable actions mean for them. And there is a very nice formula that they have told us. It's easy to remember for us. The formula is, it's called Law 3MW. Law stands for light, air, water. Conserve light. There are excellent examples from developing nations and from developed nations. For example, in Singapore, there is an example from Rwanda. There's a fantastic example from actually Nigeria, where they have done away with the lighting during the daytime and built excellent light passing through the large windows, the glass windows that they have built. And these are all available case studies across everywhere. Airways, we understand there are many hospitals which have done away with air conditioning and taken in natural airflow, and there is very good feedback from the patients on this. There's one hospital, Rainbow Hospital in Bangalore, which is doing a lot of experiment around this airways part of it. The water part, all of us understand how do we kind of conserve water. Then comes the 3 M's. machine, materials, manpower. The machines that we need to use need to be energy smart. The materials that we use to paint, to build our facilities need to be environment smart, and today there are many available. But also it is very important for us to understand that hospitals are run by humans, and they must be trained to understand how to conserve energy, how to become climate smart. And the W part is easy. It is about waste management. We saw a very good kind of slide on how waste management needs to be done. So across the Law 3MW, we are working with various hospitals, and various hospitals are adopting it, and we are seeing very good results. We are doing very good case studies on it. And here I also want to tell you that most of the hospitals that are really shining bright in terms of becoming climate smart are from the small towns of India, are from the ones which are in the second and the third tier cities of India. And very recently, there was a Global Health Award on Climate Smart Hospital. The hospital that won it from India was a Lombard hospital in Udupi, which is a small hospital in Udupi, but following every step of becoming climate smart. There are so many examples. The Arvind Eye Care Hospital is a global example of how they have taken this forward. There is a second topic that we had, which is about technology, as to how do we use technology. One thing is very, very clear for us, that technology, while it is a very important intervention and has to be used, the healthcare of the future, it is believed, will be run on a very simple 3T parameter. One is technology, the artificial intelligence, the various kinds of digital technologies. The second T is about trust. The involvement of the community, the engagement of the community, to make them understand as to how technology is benefiting them in terms of providing sustainable healthcare is a very, very important communication that we need to have. And the third T is about teamwork. The public sector, Dr. Madan Gopal made a fantastic presentation of India. It makes us proud that India is moving in such direction, but it is not only about the public sector. It is about the public sector, it is about the private sector, it is about the non-governmental organizations, it is about the non-profit institutions. All of them must join hands in order to take this forward. So technology, trust, teamwork are going to be the drivers of our healthcare in the future. I said that, I will not show you slides because there is no point, all of them have been discussed, but I want to show you my last two slides because so I want to show you something which is about Imagine. This is from the National Health System from UK, National Health Services from UK. One of my teachers in public health used to say that if you want to deliver something, first dream. Dream about what you want to deliver. What is your ideal delivery? What does your ideal delivery look like? So therefore, I would like to leave with you an imagination, a dream about what sustainable healthcare will look like when we become the advanced India, developed India, 2047 and beyond. Imagine a time when going to hospital is seen as a failing of the health and social care system, when most of the care and support you need can be offered at home, when you can get instant medical help online by phone or at a local health center, when health inequalities are low and well-being is key. Imagine a place where the few buildings that support the health system are in tune with the environment, they use almost no carbon, and are integrated into the community and with nature. They are inviting for patients and a pleasure to work in. Imagine a world where friends, family, and society help promote healthy living, where we all support the local health and social care system to recycle, reuse, and minimize waste, where we know that delivery of services takes the long-term financial, social, and environmental costs into account, knowing that we have done our best to improve health and minimize our impact on the environment. Thank you.